everyone, my name's Jess.
I'm Keely.
I'm Coulter.
And I'm Paige. And we'll be presenting on the use of microneedle technology in anxiety treatment.
So currently in the United States, there are 40 million adults living with anxiety, and of those 40 million, only 36.9% of those are actually receiving treatment. And for patients with anxiety, they're 3 to 5 times more likely to go see a doctor.
We compiled a list of the needs for anxiety medication for drug release, and on this list was patient compliance, pain-free administration, controlled drug release system, effective delivery, and affordability for the patient. So through these needs, we compiled a chart, and as you can see, we included currently the only patch on the market, and then oral medication for 4 of the most common drugs, and then we included our microneedles, and there are currently no microneedle applications for anxiety medication on the market. But by looking at the needs, currently microneedles fulfill all the needs, while all the other products on the market do not fulfill all these needs.
So here's our visual representation of our proposed device. It's called the Wrist Assist, and you can see it in full in the top right, where we have basically a bracelet with an attachment where a microneedle patch can be inserted. And you can see a closer rendition of what this looks like in the bottom right, and our full dimensioned microneedle patch in the left. Our design criteria is what established how we wanted to have our geometric relations and how large the size of this microneedle was. The first thing that we looked at was the puncture forces. In order to properly be inserted into the skin, it needs to overcome 3 newtons of force, or compressive force, without any plastic deformation or any fractures upon insertion. So we wanted to arrange our geometry for a way so that insertion could be nice and easy and for a patient to do almost themselves, which is why we devised a 1 millimeter long tip with 300 micrometer pyramid base shapes, and then also with a 1 micrometer tip to make it sharp and easy upon insertion. We also wanted to look at the dissolvability of microneedles because we want controlled release, and that's where we decided to have a carboxymethyl cellulose polymer-based system where it could release over 5 days and have about a 1 milligram release where almost all of the release of the drug can be seen.
So regarding costs, unfortunately people living with anxiety have to pay a lot for their treatment. So on average at the moment it's $6,475 in one's lifetime. So we've comprised a table with 3 very common pills, the only patch on the market, and then the microneedles. And as you can see, it's very expensive costs per month for all these products. And just regarding material costs for our microneedle patch, it would be approximately $2.28.
So as Jess said, the material costs of our device are fairly low. To actually create the microneedle patch or microneedles out of the CMC, it's less than $0.01 per patch. And then as for our drug, it's about 38 cents per milligram. So since it's 1 milligram per 5 days, you would need about 6 patches per month, so it'd be about $228 per month in total cost. But of course, there are additional costs due to manufacturing of our device and also maintaining sterility. And then currently insurance right now will cover portions of anxiety medication, but insurance companies are sometimes hesitant to cover novel therapies. So initial costs for patients may be higher, but in the long run, we think that our device will be much cheaper than current treatments.
So we're very aware that the success of a product comes from the opinions of doctors and patients. So we spoke to Dr. Lisa Scheib, and she kind of agreed with us on a lot of benefits of our product. So that includes no pain. So microneedle patches are thought to feel like Velcro or like a cat's tongue. And that's because it doesn't pierce far enough into the skin to reach those sensors. And also for that reason, there will be no skin irritation or bleeding. It's also a 5-day treatment, low in cost, as Paige mentioned. Discreet treatment, so enclosed in a bracelet, which is also customizable because we offer stickers which make it personable. And then additionally, it can be as needed or daily treatment depending on which technology you utilize. And then some things to be wary of as well is maintaining sterilization throughout the process. So there is a study in Australia right now which is utilizing silver in the microneedles, utilizing the antibacterial properties of silver to keep this sterile. However, this does need more research before it can be incorporated into our product. As well as the placement on the wrist could be an issue, and that's only because of the force applied on the wrist daily, anything from getting up from a table or clapping. So here's one last look at our product. As you can see, the bracelet, the microneedle, and here are some of the stickers that could be customizable. So thank you for listening, and we'd be happy to take any questions at this time.